Welcome to Allowed to Talk, the show where we can talk about anything. And on the show today, I want to talk about something that I just found out about 6 months ago in May of 2023. And here it is October of 2023 already. So on the show today, we're going to talk about Roemheld Syndrome. If you don't know how to spell it or you never heard of that, like me 6 months ago, I never heard of it. It's spelled Roemheld and then syndrome. They call it Roemheld Syndrome or RS. I think there's an RS for another like respiratory disease. That might have another initial. RVS, RHS. Anyway, Roemheld Syndrome, Roemheld. Now, when I found this back in May of 2023, it's when I was waking up at night with heart fluttering, not palpitations or my heart racing, but the fluttering of the heart, like something was pushing up on my chest here, pushing up into my heart, making it flutter when I lay back in bed. But I also sleep sort of sitting up with 2 or 3 pillows. And I was in the camper at the time because we were camping, so I had 3 pillows behind me, still trying to sit up. And sometimes when I put my feet up, my knees up, laying down, it would get better. Or sleep with my arms up over my head, and then it would feel better too sometimes. Or just not eating gassy foods also, or eating nothing. Some days I only ate 1 banana, which wasn't good for sure. And that's how I was feeling for about 6 months. And then the rest of the story is I had cardiac workup, and they said my heart was fine for an old lady. And then I had the gastro workup, and they're saying my stomach has mild inflammation, and they did some scrapings to do a biopsy to check for H. pylori again, which I had H. pylori about 2 years ago. But Roemheld syndrome, let's talk about it. I'm going to read right now a little bit what I found on the internet when I Googled Roemheld syndrome. And this article is from 26 April 2022. So it's about a year and some months old. But here's what they say about Roemheld syndrome. Between the decades of 1910 and 1920, Dr. Ludwig Roemheld studied the phenomenon in which patients suffered from digestive problems and no detectable heart issues. They would also experience cardiac symptoms, even though they didn't have any heart issues. Bing, 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 ding. That's exactly what I'm going through. By the 1940s, the Roemheld's research received more attention, and the medical community would eventually accept the existence of the gastrocardiac symptom complex, also known as Roemheld syndrome, RS. The most common model known for Roemheld syndrome involves some gastrointestinal problems or disease that leads to arrhythmia or other types of abnormal heart rate issues. Fluttering, your heart fluttering. Although the precise interactions involved in Roemheld syndrome are not well described, anatomical proximity, the vagus nerve, that's one thing I mentioned to the guy when I was having the upper scope done, that I think my vagus nerve is involved. It feels like that to me. Don't ask me how I know that. Someone told me about the vagus nerve, my youngest daughter. And I said, bing, that sounds like what I'm going through too. So the vagus nerve, VN, and electrolyte deficiencies are still considered as equally valid candidates for the key element in Roemheld syndrome, with the vagus nerve being a well-supported option. Okay, yeah, I am very anxious. I worry about things, which I know is a sin. Worry doesn't add to your life, not even 1 second, and you shouldn't worry, but I'm very concerned and serious and sensitive. And my one granddaughter calls me a worrywart, which I am. So yeah, this Roemheld syndrome, when I looked it up back in May, this is what it sounded like. I thought, no, I must be having heart issues. I'm an old lady. I'm 66, so it's my heart. Even though I was dancing a lot on these videos and keeping up with my husband when we went to like an art museum or to the place in Arkansas that we were going to, Eureka Springs and all that, but still. And when you talk to these doctors in the gastro and the heart, when you say Roemheld syndrome, they act like they don't know what you're talking about. They act like they've never heard of such a thing and they don't believe it. But it's since 2022, this article says it is finally accepted as something. So it is not a disease, Roemheld syndrome. It's just a particular combination of symptoms appearing together being caused by one or more pathologies. Although in the first publications discussing this phenomenon, several authors, including Roemheld, mentioned how frequent he was to see the patients with gastrointestinal diseases presenting with Roemheld syndrome. Very little information about this syndrome's epidemiology is available today. In fact, observing Roemheld syndrome personally seems to be so rare that a big portion of all modern publications on this topic tend to be case studies about individual patients. Bing, bing, ding, bingo. Overall, even patients with the exact conditions to be diagnosed with Roemheld syndrome usually aren't. Yeah, I'm just diagnosed with acid reflux, GERD, esophageal reflux disease, GERD. Okay, we're not diagnosed. Overall, even patients with the exact conditions to be diagnosed with Roemheld usually aren't diagnosed with it. The connection between the gut and heart symptoms is made, but the syndrome is rarely mentioned. Tell me about it. In this article, we'll examine the available information for Roemheld syndrome to provide hard facts and its causes, specific symptoms, people at risk, diagnosis, treatment, and prevention. Okay, so I don't have to read about it, but I do have this, if I eat the really bad foods that are real greasy, and acidic, tomato, lemon, lime, things like that, drink lemonade, I get the gas. And we know the primary cause here, they're saying, of Roemheld is the accumulation of gas in the gastrointestinal tract. Yes. Initially, physicians assumed that those who experienced Roemheld syndrome were producing more gas than usual through fermentation, part of the normal process of digestion. However, as time went on, it became clear that for a great majority of the cases, the problem wasn't the gas produced, but the gas ingested. So if I eat right, it's not as bad. But because that's why I lost like 15 pounds in 3 months, because I couldn't eat a lot of foods. And some days I only ate one banana, which isn't good, nutritionally, to only eat one banana a day. Okay. The aerophagia, which is a phenomenon, the excess swallowing of air. I'm a mouth breather. My daughter told me to start breathing more through my nose. I understand now, and I've been doing that, and it helps. The excessive swallowing of air seemed to be more pronounced in individuals with Roemheld syndrome. It's considered that any condition that promotes aerophagia, it's aerophagia, A-E-R-O-phagia, P-H-A-G-I-A, aerophagia will also increase the risk for Roemheld syndrome. The gas is the problem that leads to it. However, for someone to develop this condition, the vagus nerve, which is right behind your heart, it goes up to your brain. The vagus nerve is the key. If this nerve can be easily overstimulated by the stress in the GI tract, then it is much more likely for the heart's rate of pulsations, fluttering per minute to become affected. I'm saying fluttering because they're saying pulsations, but I felt fluttering, like my heart was dancing, which isn't good for you, really. The pulsations per minute to become affected, normally decreasing and then increasing rapidly, fluttering. Considering this, a pre-existing or easily producible vagotonic condition could also be considered as a case, or at least a main contributor factor for this Roemheld syndrome. Now, is there any way to get rid of Roemheld? No, you can only treat the symptoms. There's no cure for it. But here are some things that are my condition, my physical health, that I have. I have lactose intolerance. If I drink milk without it being lactose free, I get really sick to my stomach. And I'm pretty sure that also gluten is a problem for me because I went gluten-free for a month or two when I was in Delaware. Well, that was 3 weeks with a friend that was gluten-free, and I felt much better then too. So gluten. And then they say hiatal hernia, but they ruled that out. I don't have a hiatal hernia. Enteric disease, I don't know what that is. A loss of ability to burp. Well, I don't burp as much, but I still burp. I don't have a bowel obstruction, and I don't have acute pancreatic necrosis. At least they said not. But, who knows? But the symptoms of Roemheld syndrome can manifest in several different ways. These are the most common symptoms that are reported by patients. And I'm a patient right now with gastro. So here we go. Sinus bradycardia. My heart slows down and then it goes on that fluttering thing. Shortness of breath. If I run real fast, I'll get that. Chest tightness. I think I'm having a heart attack sometime. Muscle cramping. No, but dizziness. I have that vertigo, BPPV, benign paroxysmal positional vertigo. But that, they say, is from a crystal near, and it is only the left side. But I do get dizziness just standing up too fast or moving too fast. Palpitations, heart fluttering, belching, nausea. That's what I get. Sick when I eat certain foods. A lot of tomato-based foods. I'm sick. Ice cream without being lactose-free. I'm sick. Drinking milk. I'm sick. Eating a lot of starches, a lot of foods that aren't gluten-free, a lot of bread. I can't even eat bread. And then the irregular heartbeat, arrhythmia, and then rapid heart rate when it flutters, tachycardia, panic attacks. I've been having panic attacks since I'm in my 40s. Confusion, I can't remember things, but that could be the old age. Anxiety, woohoo! I'm anxious a lot. And sometimes I'm in a bad mood, but they're saying depression. And my blood pressure fluctuates, but especially white coat syndrome when I go into the doctor's office. And when she took my blood pressure at the place where I was having my heart checked, the cardiologist, and she didn't retake it. I told her I was excited and upset about waiting so long in the waiting room. It was high, like 166 over 99 or something. So they wanted to put me on blood pressure meds. And my blood pressure is usually right there on the line or average or low. So I said, no way, I'm not going on blood pressure meds. It fluctuates. If I get all worked up and anxious and excited, it goes high, but it's usually 120, 110 over 80, 75, around there. I took it for like a week after that, and it was not high at all. As long as I don't have to deal with doctors' offices, clinicians, and nurses, and people making you wait a half hour when your appointment was, you know what I'm saying. You know exactly what I'm saying. When your appointment was at 2 and you're still sitting there at 2:30. Lightheadedness, I have that sometimes. Vasovagal syncope, fainting. I've already fainted a couple times. As a kid in high school, I fainted. Doing the, that run where you run, it's cross-country run. I fainted coming back from that. Ringing in ears. I don't have the tinnitus. Sometimes I do, but that's when I have my earbuds in a lot. And fatigue, man. 2 years ago, right before COVID, which I had COVID later, like a year after COVID came, and when it got to a milder case of COVID, I got it. Like a 2-year thing in between the first initial things of having coronavirus, COVID-19. I was so tired all the time, fatigued and tired. So yeah, and this could be some of the things I'm doing. As we mentioned before, aerophagia is an important element in Roemheld syndrome, Roemheld syndrome, and those with this condition will be at a higher risk of developing the syndrome. Aerophagia is common in people who have habits of eating too quickly. I eat fast. When I go and eat, I'm so hungry. I can't believe I'm done already because I eat fast. Talking while I eat. This show is called Allow to Talk, so I talk a lot, even while I'm eating. Yes. Drinking through straws isn't good. I don't do that often, but I do that. Smoking, which I don't smoke, so that's not one of the things. Breathing through their mouths. Yeah, that's one of my things I do instead of breathing through my nose. My daughter said we were going into a store, and she goes, Mom, breathe through your nose. because we were walking across, the mall, the strip mall, and she said, breathe through your nose. Okay, so I did, and it works. It helped me to feel better if I exercise vigorously. Well, yeah, I dance around a lot and around the house, and yeah, but I like to dance, and I'm not going to stop dancing, of course. Drinking carbonated beverages. Last night I had a ginger ale before bed, like 9:30, 10 o'clock. And it was sugar-free, but it was still the carbonation. And man, did I have a lot of that fluttering. Yes, even after my diagnosis of just having mild inflammation in my stomach, I had that heart fluttering, and I had to sleep with my arms up or sitting up in a chair or bring my knees up while I'm sleeping. Bring your knees up. And drinking carbonated beverages, I read that one. And wearing loose-fitting dentures. Well, I don't have dentures yet, so that's not it. And then it talks about sleep apnea and respiratory problems. But this is how they diagnose this Roemheld syndrome. Diagnosing Roemheld syndrome is not easy, and due to its nature, many will be misdiagnosed with either a non-existent heart condition or a mental issue. Go figure. Well, I have mental health issues. That's a long story too. So patients experiencing will vary considerably depending on which doctor they visit first. Since the most obvious symptoms of Roemheld syndrome are very similar to those belonging to many different cardiac diseases, most patients will visit the cardiologist first. That's where I went first. Most doctors will focus on finding a heart problem that is not really there, and they ruled out that my heart was fine. With that purpose, they'll use diagnostic tools like EKGs, Holter monitors. Yeah, I did the slope test. I did the Holter monitor. I had an EKG. I did the thing on the treadmill, cardiac MRIs, cardiac CTs, cardiac catheterizations, EP studies, echocardiograms, and many blood tests, sleep studies, and even I had a sleep apnea test back in my 30s because they thought it was sleep apnea. If everything goes well, no heart condition will be found. They found no heart condition with me. Some patients are put under psychological examination to detect any signs of anxiety, depression, or conversion disorder, mainly because their symptoms will appear to have no physical cause. Gastroenterologists have the best chance of diagnosing Roemheld syndrome in symptomatic patients by performing colonoscopies. I had that. And endoscopies. I had that. And ultrasounds. I didn't have the ultrasound. Well, they probably won't go there because they think I'm nuts. They don't think there is a Roemheld syndrome. This way, a doctor will be able to, that I added about them thinking I'm nuts. That's not on the paragraph here in the article I have pulled up on the internet. This way, a doctor will be able to detect the presence of a gastrointestinal problem leading to a distended GI tract. Linking the cardiac symptoms to the GI issues is more difficult. Roemheld syndrome. Diagnosis at this point is not an exact science, and only recently the medical community has started to consider this type of association between the digestive and circulatory systems. Bing, 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 ding, ding, bingo, in the context of treating arrhythmias. If Roemheld syndrome is suspected by a doctor, a combination of X-rays and EKGs to detect simultaneous air-filled bowels and arrhythmia has used to affect diagnosis. However, improvement of cardiac symptoms after treatment of the gastric condition is the strongest confirmation for Roemheld syndrome. Yes, I've been treating myself that I don't have a lot of gas or air. They gave me the omeprazole 40 milligrams. I'm taking it at least an hour before I eat in the day, and I'll see if that's going to help with the acid that builds up. But as far as the gas and the pressure on my belly, when it's filled up with gas, pressing up on my heart, that is definitely what I think is going on with this. Because over time, and losing weight helps. Yeah, I lost 15 pounds. I'm going to keep losing because I don't want this feeling when I lay down at night after I have a carbonated beverage. I love water, and I could drink water, and I can't drink tea because I have to get decaf tea because caffeine makes my heart race too. So lemonade, sugar-free lemonade, and water. So I can still drink good things, water especially is good, but there's no definite care, but it can be managed with treating its symptoms. The following medications are very helpful. Anticholinergics or magnesium, sodium supplements to raise your blood pressure. Well, mine drops, but I'm not taking that. Anticonvulsants like lorazepam to help regulate, modify the GI tract and the vagus nerve. Yes, that makes sense. Alpha and beta blockers to increase motility and regulate heart rate, respectively. Anti-gas, that's where I'm at. The anti-gas reduce gastric pressure. I might even want to take, I put them up here from when I was, the Gas X. The gas relief, if you can see that. The Gas X. I guess you can see it's a little green pill. I took that to get prepared for the, took this too, but I don't think that'll help with gas in your belly. That was a stool softener to get ready for the colonoscopy and the endoscopy, upper endoscopy. And then antacids help with your acid reflux. Some sources mention vagusectomy and other type of treatment, but we've not found information to support this option. Vagusectomy, so go in and cut your vagus nerve. I don't know exactly what that's about. Okay, prevention of Roemheld Syndrome, Roemheld syndrome. A healthier lifestyle and reducing some of the behaviors that lead to gas accumulation in the intestines will help prevent it. Eat slowly and with your mouth closed. Now, that I haven't been doing. I'm going to try that today. Never smoke. I don't smoke. If you need assisted breathing, check with your doctor to determine if your equipment is properly calibrated. Well, I'm not there yet with needing oxygen. Reduce FODMAP. FODMAP is capital FODMAP. And I found that diet right after that I found Roemheld, and I was following that, and I felt so much better. So I'm going to go back to the FODMAP diet, FODMAP, caps. And it will help prevent gas, and it tells you what you can and can't eat. Like if you want to eat, like out of these 3 fruits, watermelon, cantaloupe, or honeydew. The watermelon is a harder one for your gas, but cantaloupe and honeydew are better. They had the good, okay, and the worst of every food. And I'd suggest if you're having any kind of gas problems and pressure on your heart with a lot of gas, that you would follow the FODMAP diet. That's good for people that are gluten intolerant too. FODMAP caps. It will help. By following that diet, it will help prevent gas accumulation. And you can use magnesium supplements and regular exercise to make your heart stronger. So I dance, of course. So here, magnesium I was taking in like 2 blood checks ago. He said it was sky high, so stop the magnesium. But if I get it checked again, all my blood work was within normal limits. I think that my cholesterol was like 1 or 2 points higher than they like it, but my good cholesterol was so much better. They said I didn't need cholesterol medicine. But I'm saying here, and think I'm crazy, go for it. I don't care. I know the truth, and I know what's going on with my own body. And I have Roemheld Syndrome. And I'll say it to every doctor I'm with. And I talk about the vagus nerve being involved too. And the things that I do that my daughter said would help is breathe through your nose more. Now I know to eat slower, exercise every day, eat less food. I'm only eating 2 meals a day. I fast through breakfast unless we're going out. And I'm taking the omeprazole, 40 milligrams for 8 weeks to help with that. And then I'm going to go back to the famotidine, because I think that's probably a little better for me than taking the omeprazole. But the things I'm doing, I'm sleeping, sitting up with I have a Craftmatic, I have a sleep number bed here, right here, and I keep it up, sit up while I'm sleeping, and that helps a lot. Or if I can't sit up, I'm visiting or in a hotel, I bring my knees up and I use 3 to 4 pillows to sleep sitting up. And what else am I doing for the Roemheld Syndrome? I'm trying to stay not as anxious and upset about things. If it's a bad situation, like a family member upsetting me, like someone that is a very cruel person, I will have no contact with them. or I can leave, go to the ladies' room if it's a party, or just say I'm going to leave now because I want to go home and relax, put my legs up, whatever. And also, when you're showering, at the end of your shower, make it 30 seconds or so of the real cold water on your face and chest and on your back a little. That helps a lot. Brushing your teeth and getting that gag reflex a couple times, 2, 3 times, to get that gag reflex better. And just when you feel like you have to cry, cry. I hold that back sometimes. I think I'm not allowed to cry about anything or have emotion. But you can. And I believe Roemheld syndrome is really something. It is a definite diagnosis, and there's no cure for it, but there's things you can do. Look it up. You can look up things to help you. So that's the show today. I hope you learned something. I hope you're having a wonderful day, and that you just keep singing and dancing.